And friends, it's so good to be back with you again on this another Sabbath morning for a health nugget. This morning we have with us Dr. Lenward McCalla, a very good friend of mine. I really admire this gentleman, and I know that you will be blessed by the information that he has for us today. Dr. McCalla, tell us a little bit about yourself.
Well, I was actually born on the beautiful island of Barbados. We
Amen
share
to
that
that.
in common. And my father was Pastor McCalla, my mother, Dr. Gloria Joyce McCalla. I lived in some of the islands, moved here to Miami when I was 10 years of age, went to the local schools like GMA, Greater Miami Academy, went off to Andrews for my 4-year degree in Bachelor of Science in biology. Came back to the University of Miami, did a couple of years in research in the Department of Neurology. I researched MS, multiple sclerosis. Then I went off to optometry school from 81 to 85. I graduated with my Doctor of Optometry degree, and then I did a residency program, a 1-year residency in what you call primary eye care, which deals with how it affects the eyes, how the diseases of the body affect the eyes.
That's really great. I'm delighted to know a little bit more about you today. We know that you practice here in the South Florida community. How has the COVID situation affected your practice?
Well, it's affected it tremendously. First of all, we stopped seeing routine patients. And we've been seeing only patients with red eyes, infections, major issues, or patients that we have no other choice. And so I've been going in occasionally, not every day. But just as of last week, I just started seeing regular patients again, but in a shortened format where we've stretched out the exam so that instead of seeing patients every half hour, we'll see them every hour.
Wow. Well, you know that we're going through this COVID crisis more so today in this particular time. And we have been hearing from a lot of the presenters here multiple symptoms that COVID may bring to different individuals. We know of the problems they have with clotting from Dr. Ned. We've heard about some of the other immune challenges, loss of smell, loss of taste, other neurological dysfunctions. Can you tell us a little bit about what type of symptoms we may see as far as the eyes go and vision go with reference to the COVID situation?
Well, with COVID, it seems that they've done a couple studies, different studies, and we find that the first study that came out said that about 30% of the patients who have COVID-19 end up with a type of a pink eye. Subsequently, other studies that were done showed that that was actually probably overestimated, and it's really down to about 1 to 2% of people. So they'll get red eyes, they'll get itchy, they'll get itchiness, they'll get maybe swollen, teary-eyed, and that's part of some of the symptoms that they'll get.
Do those symptoms then? I know that those symptoms are not common exclusively to COVID. So is there any peculiar symptoms, or is just the general symptomology that people may get?
Yeah, those other symptoms are very common to many other things with the eyes. Dry eye, you can get other types of viral infections. So there are a host of other things, allergies and so forth. But specifically, COVID, as far as it affects the eyes, there are really 3 ways I anticipate we're going to see. First of all, we get a few patients who have the pink eye. You're going to get the patients who are in the hospital. They're going to get hemorrhagic problems in the retina because they have those same issues going on in their lungs, and whatever's happening in the body is happening in the eye. So a few patients are going to get that and may even have some loss of vision.
Wow.
And thirdly, patients who are affected neurologically. If it's in the visual part of the brain, they may have trouble with their vision, may have, again, some loss of vision because they are not able to process signals for vision signals any longer in the manner that they did before. They also may have trouble with tracking if it deals with how the eyes track, the part of the brain that tracks. So we may see patients who recover who have visual symptoms after that we have to deal with. As of now, I haven't seen any of those, but those are what we are looking for.
Okay. Now, we've been told a lot about not touching our eyes, and if we touch certain surfaces, we should wash our hands and make sure that they're clean before we touch our eyes. How transmissible is the virus in the eyes or to the eyes? And when it gets into the eyes, let's say I cry on somebody, or I cry and wipe my tears with my eyes, am I then an agent of transmission also? Can you explain that to me a little bit?
Yeah, it seems that they have been able to isolate the virus in the tears. However, most of the people who have had the COVID-19 and they've tried to do that, most of the time they have difficulty. So it appears that it's very difficult to catch it that way. However, the eyes are still a route of that you can acquire the virus. For instance, people who wear contact lenses. Well, if the contact lens is bothering you, you're going to probably rub your eyes unconsciously. So we suggest if you are wearing contacts or tend to wear contacts and they bother you, wear your glasses instead. If you're especially around somebody who may have it or in public and you have glasses, then we advise you to wear them, because just the droplets, the respiratory droplets by themselves can cause, you can get a few of those droplets in the eye and you end up acquiring the disease. I guess it's again, the chances are very small, but it's possible.
Okay. I know from my biology classes that the lacrimal glands or the tear ducts drain into your nasal area. Does that also lead to like the virus spreading into the upper respiratory tract areas and into the lungs from the tears and or from eye exposure?
Yes, that's very likely. Very likely that can happen, and the reverse too. We get it traveling back the other way. So generally, if someone has it in the lungs, it very well can travel up and get into the eye that way.
Okay. Now, what precautions then can we take to guard our eyes? I know some of us obviously wear glasses. Some people wear shades. In the hospital, they have these coverings that they wear over their faces and stuff like that. But I guess we don't do that in the regular community. Can you tell us anything that we can do to protect our eyes? Should we buy goggles? What can we do?
Well, because the risk is very low, we probably don't really, all of us need to wear goggles, especially if we maintain a 6-foot distance. It's unlikely we're going to catch it. So yes, it may be good to have a pair on hand, but I don't think we need to wear it most of the time. And especially if the person you're encountering is wearing a mask and you're wearing a mask, it's unlikely you're going to get any of the virus in your eye.
Okay. So you're a strong supporter of wearing masks when we have to speak to people within distances of 6 feet, basically?
Oh, yes. It's absolutely necessary. Absolutely.
Okay. The COVID crisis has caused a lot of challenges with people being unemployed and having to go back to work and stuff like that. How has that affected your practice? Are you seeing a lot of patients coming back, or are they scared to come out, or how is that affecting your practice dynamic?
Yeah, actually, it's very interesting. When I opened up with this week, we had a full book. I mean,
wow.
And we are actually booked up for several weeks because of that. And I think people who have been delaying, putting things off, wanted to come in. And so we have a difficult time spacing them out because they want to be seen. They're begging. We have people who their driver's licenses are expiring, so they need to have an exam.
Yes.
We have people who have glaucoma, they need to come in for their check. People who have taken certain drugs that have macular, that can cause cataracts or macular diseases or increase the eye pressure, they have to be checked. So we've been pushing people back, but now we have to see them. And, it's quite a lot at one time.
Well, I can see how that can be problematic. How can we, as a church, therefore, help people to cope with these challenges that COVID may present in their lives, as far as you see it from your particular occupation?
You mean as far as people coming back into church, or just as at home?
Well, no, both areas, both at home and at church, as they come back to worship with us and as they stay home. How can they use your skills or your knowledge to be better prepared for meeting people and going back out?
Well, the main thing, I think, if they just follow the rules that have been given to us by those in charge, the CDC and so forth. Wear your mask when you're out. I see people wearing the mask, but it's coming down, and people come in the office and it's down below their mouth. We have to remind them to pull it up. Wash your hands. Please wash your hands. Wash your hands, and don't touch your face. See, there's a tendency for us to want to touch our faces, but try to avoid doing that at all costs. And again, if you have glasses, it's better to wear the glasses than to wear your contact lenses.
Okay. Well, thank you so much. But one final question I have for you then. Outside of the immediate challenges with the virus, any other tips you have for us today on personal eye care that may help us to protect our vision and protect our eyes for a longer time, to keep them viable for a longer time?
Well, the main thing when we discuss vision is to think about it. The main thing is prevention. Most of the eye disease and the eye problems that we develop can impair our vision. Whatever we prevent or delay from happening, the better off we are. So early detection is the key. So if you're noticing any slight changes, you should come in right away. Any slight changes in your vision, come in right away and have it checked. If you have glaucoma, for instance, in your family, or you have it, make sure you do your routine checkups, take your medication. So it falls on us to do the right thing. And if we do, there's no reason why we should lose vision for most people. 95% of the population should maintain their vision for most of their life or all of their entire life.
Well, Dr. McCalla, I want to thank you so much for the information that you've given us this morning. For me personally, it's been quite helpful. I know that I was recently diagnosed with glaucoma. It runs in my family, but I never thought that I should have been checked for it until recently. And when I went in, I found that I had already lost about 30% of vision in my right eye and that it was progressing. So now I have to be on medication for the glaucoma. So I agree with you 100% that we need, when we have a family history, that we need to check and make sure that we get things put in order so we can be on the right medication and provide the right care for our eyes. And when you have other diseases like diabetes, etc., you definitely need to make sure that you keep on checking. So I definitely encourage you to check out Dr. McCalla, make sure that you get your eye care done and make sure that you are in good health, keeping vision as long as you can. You know, it was said of Moses that he lived 120 years and his vision had not dimmed. So I hope that you can live 120 years and that your vision not dim. God bless you today, and we thank you so much for joining us for another Health Nugget at Tabernacle Seventh-day Adventist Church this morning.